NCLEX NGN RN, with all questions format, newest actual exam, all 150 questions and correct detailed answers with rationales. Question 1. A nurse is preparing to administer insulin to a patient with diabetes. Which set of actions represents the correct safety protocol? Verify dose with another nurse, monitor blood glucose, and check expiration date. Administer via intramuscular (IM) injection and verify the dose with a pharmacist. Monitor blood glucose and check the expiration date, but skip the double check for rapid-acting types. Check the expiration date and administer the dose via a 1.5-inch needle into the deltoid. Insulin is a high-alert medication. Correct administration involves 1. Verifying the dose with another licensed nurse to prevent calculation errors. 2. Monitoring blood glucose to ensure the patient needs the dose and to prevent hypoglycemia. 3. Checking the expiration date for efficacy. Insulin should be administered subcutaneously, not intramuscularly (IM), as IM injection can lead to unpredictable absorption rates. Question 2. Which combination of lifestyle modifications should a nurse recommend to a patient recently diagnosed with hypertension? Limit sodium intake, increase physical activity, reduce caffeine, and avoid alcohol. Increase physical activity but maintain high sodium to prevent hypotension. Limit sodium intake and reduce physical activity to lower cardiac workload. Reduce caffeine intake but increase alcohol consumption to promote vasodilation. The management of hypertension involves several concurrent lifestyle changes: sodium restriction, to reduce fluid retention, regular physical activity, to improve cardiovascular health, reducing caffeine, a stimulant that increases BP, and avoiding alcohol, which can interfere with BP medications and raise blood pressure. Question 3. A nurse is assessing a patient receiving chemotherapy. Which group of symptoms should be prioritized for reporting to the healthcare provider? Nausea, vomiting, fatigue, and weakness. Dry mouth and difficulty swallowing only. Hair loss and dry skin only. Increased appetite and improved sleep patterns. While hair loss, alopecia, and dry mouth, xerostomia, are common side effects of chemotherapy, nausea/vomiting can lead to dangerous electrolyte imbalances and dehydration. Fatigue and weakness may indicate anemia or neutropenia. These systemic issues require medical intervention to adjust the treatment plan or provide supportive care. Question 4. A patient with a history of heart failure reports a 5-pound weight gain over the past week. Which actions should the nurse anticipate taking? Increase the diuretic dose and restrict sodium intake. Increase fluid intake to flush the kidneys and increase sodium. Administer oxygen therapy and provide a high-fiber diet only. Increase the diuretic dose but encourage a high-sodium diet to balance electrolytes. A weight gain of 5 pounds in a week, or 2-3 lbs in 24 hours, in a heart failure patient indicates fluid volume overload. The nurse should anticipate an increase in diuretic therapy, such as furosemide, to remove excess fluid and a restriction of sodium to prevent further fluid retention. Question 5. What is the correct priority sequence for interventions following a total hip replacement? Ambulation, pain medication, CPM machine, then ice. CPM machine, ice, ambulation, then pain medication. Pain medication, ice, CPM machine, then ambulation. Ice, pain medication, ambulation, then CPM machine. In postoperative orthopedic care, pain management is the first priority to allow the patient to participate in later therapies. Applying ice follows immediately to reduce surgical swelling. The use of a continuous passive motion (CPM) machine or similar device helps prevent venous thromboembolism (VTE). Finally, assisted ambulation is performed to promote long-term healing and prevent complications of immobility. Question 6. A nurse is monitoring a patient receiving chemotherapy. The patient is at the highest risk for which life-threatening condition? Neutropenia and subsequent infection, polycythemia and blood clots, hypertension and stroke, hyperglycemia and diabetic ketoacidosis. Chemotherapy often causes bone marrow suppression, myelosuppression. This leads specifically to neutropenia, a low white blood cell count. Because neutrophils are the primary defense against infection, these patients are at extreme risk for sepsis. Nurses must monitor for fever and chills as these may be the only signs of a severe infection. Question 7. When administering furosemide, Lasix, to a patient with heart failure, the nurse should prioritize monitoring for which adverse effect? Bradycardia, hyperkalemia, hypotension, tinnitus, only with oral doses. Furosemide is a potent loop diuretic. By rapidly decreasing fluid volume, it can cause a significant drop in blood pressure, hypotension. Additionally, furosemide is potassium wasting, therefore, the nurse should monitor for hypokalemia, low potassium, not hyperkalemia. While tinnitus is a rare side effect of rapid push, hypotension is a primary systemic risk. Question 8. Which of the following describes the correct order of steps for checking a patient's capillary blood glucose level? Wash hands, insert strip, prick finger, apply blood, record result. Prick finger, wash hands, insert strip, apply blood, record result. Wash hands, prick finger, apply blood, insert strip, record result. Insert strip, apply blood, wash hands, prick finger, record result. Correct sequence ensures accuracy and infection control. 1. Wash hands, standard precautions. 2. Insert test strip, primes the meter. 3. Prick finger, collects the sample. 4. Apply blood, triggers the reading. 5. Read and record, documentation. Question 9. A nurse is providing post-operative care. Which group of interventions is correctly categorized as circulatory? Deep breathing, coughing, and incentive spirometry. Compression stockings, monitoring vitals, and anticoagulant therapy. Oxygen therapy, compression stockings, and monitoring vitals. Incentive spirometry, anticoagulant therapy, and monitor vitals. Post-operative interventions are split into respiratory, deep breathing/coughing/spirometry to prevent pneumonia, and circulatory, compression stockings/anticoagulants/vitals to prevent DVT, PE, and hemorrhage. Category B correctly identifies actions that support blood flow and stability. Question 10. The new generation NCLEX NGN contains 150 questions. How many of these questions are actually scored? 150 questions, 135 questions, 100 questions, 75 questions. The NGN consists of 150 questions, but only 135 are scored. The remaining 15 questions are pretest items used by the NCSBN for statistical analysis to determine if they should be included in future exams. These 15 questions do not impact the candidate's pass/fail result.